Yes, we've been calling for that with the way this administration has handled the nursing home situation, knowing that was our most vulnerable population and very easily spread in that type of congregate living setting. We're calling on an independent investigation. You know, the governor thinks he's going to get away with having the Attorney General do an investigation of the policies and the handling behind the nursing home situation during this pandemic. Well, the Attorney General in New York State, Letitia James, was handpicked by Andrew Cuomo to be the Democrat candidate to fill that position when it became vacant after A.G. Schneiderman was run out of office for, well, I'll just leave it at that. This has to be independently handled. Why did New York State come up with a policy that said, nursing home, you must take a COVID positive patient? Why did they come up with a policy that would allow a positive COVID staff member to continue to go in and work in that nursing home facility by order of the Department of Health? It's disgraceful. It's a complete mishandling of this situation. It needs to be handled by an outside investigating agency. We're hoping that the federal government, through Health and Human Services or some form, will be able to examine that. But it's been a big problem. It's led to, certainly the situation in Hornell, which was really our hotbed, or one of them, in the Southern Tier region with the Hornell nursing homes. And it's those policies that we're looking to get examined and how it was handled. You know, we were begging with County Manager Jack Wheeler, the County Department of Health in Steuben County, with Congressman Reed, with Assemblyman Palmisano, Assemblyman Burns, begging the state to come in and test all nursing home staff and residents. Department of Health dragged their feet. They required the Steuben County to go around, beg, borrow, and steal to get their own tests and administer them to all the staff at the first facility there in Hornell Gardens. The test came back overwhelmingly positive for both staff and residents. It took us several more weeks trying to get the Department of Health to come in and test the other nursing homes in Steuben County. They still refused and required Steuben County Department of Health to beg, borrow, and steal to get the tests necessary to test those people. That's just one small example in rural New York State. God knows what was going on in New York City and Long Island and these much larger nursing homes trying to fight this when the governor's order was to send positive patients into the nursing home. We need an investigation of that.